Okay, so if you could introduce yourself, say a bit about your job, where you work, what you do, and how long you've been doing it.
Yeah, no problem. My name is Jonathan Russell. I'm a orthoptist at CHOC Children's Hospital. I've been practicing for about 9 years now. At the hospital, we primarily see uh, kids with all eye diseases, but we specialize in strabismus.
Perfect. And then can you define computer vision syndrome and myopia?
Yes, computer vision syndrome is a constellation of signs and symptoms. Typically, patients have eye strain, headache, blurred vision, and dry eyes. This is brought on by excessive use of a computer screen, a cell phone, or a tablet. Myopia is a very common vision issue. It's nearsightedness. It's when you look far away, it's very blurry. It's caused by a physical problem where your eye, it's just too long. And so the light doesn't fall where it should on the back of your eye. So then what you see is blurry.
Perfect. And how long have you been observing computer vision syndrome in the children you treat in the clinic?
Yeah, that's a great question. And so when I first started practicing, it wasn't really a part of our practice. We didn't really talk about it that much, but maybe in the last 5 to 7 years, it started becoming more of a talked about problem. And then within the last few years, it's really increased after about 2019.
Interesting. Are you observing computer vision syndrome among all ages?
Yes, from about ages 3 to 4 and up to obviously everybody who we see to about 18. The interesting thing is obviously those patients can verbalize the symptoms that they have, the blurriness, the pain. And so we don't know if little kids who are using the screens under 3 are actually having this problem too, but they can't verbalize it as well as an older kid can.
Wow, yeah, interesting. And then when did you notice an increase in occurrences and severity?
Yeah, so following the pandemic, we saw a great increase in the number of children who were presenting with these symptoms. And I think at first we didn't really correlate it to what was happening, but the at-home, schooling compounded with lack of access to outside play, and no sporting. And then so what was happening was we had an influx of kids with severe dry eye, headache, and eye strain, which we would then link that to computer vision syndrome.
Right. And what do you think caused this increase?
Yeah, it was all day on the computer for school, and then afterwards, people didn't really have much option apart from being on the screen a lot. And that's what I think is great about your project, that we're going to try to kind of reverse these ingrained changes now with lifestyle. And yeah, it's definitely the increased use of watching apps for prolonged amount of time and access to handheld tablets and phones really increased that too.
Yeah. And can you briefly describe some of the worst cases you've seen and when they occurred?
Yeah, we've seen a large handful of kids with very severe dry eye, which are very difficult to treat because it's not just a medical problem, it's a social problem for the kids too, because they have to kind of change their hobbies to adapt to that. But of the worst cases we've seen an 8-year-old and I believe 5-year-old who presented with a large strabismus. So that's when your eye is inward like that. And they were complaining of double vision, blurred vision, loss of balance, and that was from excessive screen use. So in particular, we had one little boy who was playing on the computer, all day gaming, and then on a nighttime, he was continuing to play rather than sleeping. So he presented, and unfortunately, that led to a surgery to make his eyes straight. it was successful and it was resolved, but it was very, very traumatic for the patient and the parents.
Mhm. And I think I forgot earlier, but could you describe strabismus a bit more?
Yes, yes. Strabismus is just the misalignment of the eye. So that is the overall term. So for an eye in, out, up, or down. In the most cases, with computer vision syndrome, it'll be in or out, but both cause the same issues with what I described earlier, the double vision, blurry vision, and loss of balance. And if it does happen, it's very, very severe. If it's an onset like that, the child will be very symptomatic.
Gotcha. And why do you think it is important for parents to understand the condition of computer vision syndrome and its long-term consequences?
So it's really important because I think it's like starting education on digital media health and like healthy habits very early on. Because like I said earlier, like we don't know if even they're younger and they can't verbalize the problem, and we're picking it up when they're 8 or 9. So they've been having this issue for so long, and it can impact all areas of your life. But most importantly is the learning. If you've got dry eye, blurry vision, headaches, you're going to be not interested in reading, participating in class activities because you can't see very well. So it's very important that we really get the message across that this is a serious problem, but thankfully it is reversible with just some healthy habits, and that is pretty straightforward changes. And I know that you've gone over them with your pamphlet, and I'm sure you'll like us go over them more in detail, but it's just minor changes can make a big impact on the kids' lives. And the long-term consequences can be dry eye, impacted schooling. But like I said earlier, like things like strabismus can be very, very, very traumatic, and it's very important that we get this message across that this is a major problem that can be fixed very, very easily.
Yeah, awesome. And last question, what can kids and parents do to keep their eyes healthy?
Yeah. And so very straightforward. So in the pamphlet, you discuss about the 20 to 20 rules. So that's 20 minutes on a screen, take a 20-second break and look 20 feet away. And that'll help with the focus of your eyes. But also, the most healthy thing is, trying to kind of get away from the screens as much as possible, because particularly for children now, most of the schooling is done on a screen. So they'll be on a screen all day in school. So when they come home, if we get them off the screens, this will help with the CBS issues, but also with myopia. And we now know that there's a direct link from excessive screen use to progressive myopia. So that's more nearsightedness, so glasses for kids. And so the easy way with that is they're recommending right now, go outside, try for 2 hours per day. So like healthy activities, sports, playing, and it's just good for overall health, that. And it's fairly easy to incorporate, and the kids will love it, like getting out, not watching YouTube and things like that. So that's the main thing. And like for parents, setting boundaries. And we know that when they're in infancy, try to kind of do no screen time, up close screen time. So no cell phone, tablet, really, until they're maybe like 4 years old, where you can be ensure that they're not just sitting holding it for hours.
Mhm.
And there's some pretty easy steps that we can take to kind of resolve this.
Awesome. Yeah. Well, that was pretty good. Thank you so much,
No
Jonathan.
problem.